Hello, hello, and welcome to Heart Navigating Lipedema Together. I'm your co-host, Lisa Duerre, and I am here with my dear friend, research extraordinaire, CEO, founder, and everything in between. I call her the original heart guide. Catherine Seo is here from her car today because this conversation is so important. She didn't want to miss it. Catherine, welcome.
Hi, everyone. I'm so glad to be with you. It's so fascinating that we live in this day and age where um, many of you who work are trying to figure out how to do everything. Well, that's one of the things. Thank God for my iPhone. Hi, Tamara. Um, it's like, thank God that I can be in the midst of having a physical therapy appointment between getting home and having to stop at Home Depot. Because if you were around this weekend, you know I'm in the midst of moving. So it's quite a journey. But don't we all do this, Lisa? This is so much our lives.
I mean, Catherine, you're actually inspiring me so much because when we talk about a flexible work environment and navigating lipedema together, you might have to take a meeting from the car. It's just how it is, right? When there's so much going on with making sure we're managing our condition and doing the work that we do. Yeah, sometimes you're going to be in the car. So thank you for modeling that for all of us today. It's awesome.
I had a special MLD appointment with someone who's trying to help me because I've had I've had some lymphatic flares, and there was the only appointment she had for over a month.
Yep.
So it was like, you take it when you can.
Exactly. And hopefully all the employers who tune in realize, we are very motivated to do great work, and sometimes we need to take the appointment. That's what it's all about. So I'm so excited about our guest today, Catherine, because, we've been going through Lipedema Awareness Month and bringing on guests and really having conversations that get to the heart, right? We're having heart to hearts with folks. And I think today, the thing I'm so excited about is we're going to be bringing lots of hope, lots of insight and perspective, because our special guest today is, drumroll please, Dr. Leslyn Keith. Leslyn, thanks for being here today. I'm so glad you're here.
Hi, so glad to be here. I think this is a wonderful thing you guys are doing to bring more information about what it's like to live with lipedema and all the things that are out there, all the things that are happening. So I'm thrilled to be here.
Oh, thank you.
I have a few things I do want to say about Leslyn, though.
Oh, yes, please. I was going to give her formal titles, but when Catherine Seo does the intro, we know we're going to get really to the heart of it. So please do, Catherine.
Oh my God. I have to say that Leslyn is without a doubt one of my most favorite humans on the planet. In terms of her knowledge base and understanding lymphatic disorders, and that's good. I mean, that's absolutely fabulous. But what Leslyn brings is the ability to translate it into language that you and I can understand and know what to do with. And she does it with such incredible graciousness and ease and brilliance. You know, I love you. I don't often get an opportunity to be able to gush about how wonderful you are. And I've been working with Leslyn now, I think, God, it's almost 10 years. And it seems like it's an instant. Just so amazing. And so this is a unique opportunity for you all because Leslyn brings such wisdom and such knowledge and such compassion so that we can really learn.
Thanks, Catherine. I have to say back at you because this is it's been an incredible journey, an incredible process, and the things that we have been able to accomplish by working together. That day when we met at the NIH meeting was propitious indeed, and we have been able to do a lot with our combined talents.
Yeah, it's true. With such a good compliment. And I just want people to know in the background, though both Leslyn and I are not there now, Leslyn and I are both on an NIH conference for lymphatic disorders. NIH put together a commission on lymphatic disorders, and we are working with Dr. Stanley Roxon, Leslyn and I both, who are Dr. Roxon is the what do they call it? The co-chair of the commission.
Mhm.
And so when we were meeting with him last week, he was, remember to come to the meeting. So after this is over, Leslyn and I will be back at NIH.
Mhm.
I'm going to ask you guys a quick question, because we always start with, how did you meet Catherine, or why did you, what was this journey about? So when you say you met at an NIH conference, does that mean you guys were in person, or was this virtual, or how did you
Yeah, this
actually connect?
was in person. Catherine, I always forget the year. Was it
2015.
2015. And this was the first meeting that the NIH had on lymphatics and lymphatic disorders. Of course, chaired by Dr. Stanley Roxon once again. And this was huge because when you have these kinds of things that convene with the NIH, that means that you have a better chance of getting research done, of really exploring the lymphatics. And then can we get better treatments, better diagnosis, better knowledge? And so it was an absolutely amazing event. So that's where I happened to meet Catherine, and it all took off from there. I mean, and it took off like a rocket. I mean, we really started immediately doing a lot of stuff. And I have to say, Lisa, I don't want to leave you out of this, because by having you join this organization and join forces with us, it is transformed what we're able to do in such a wonderful way, that your leadership and knowledge and abilities, skills in business and working with people has been exceptional, and I think a tremendous benefit to the lipedema community.
Oh, thank you, Leslyn. I really appreciate that. Whenever I'm with the two of you, I learn so much. And Christine Halverson, will pull her quote up here. She said, yes, even this English major can follow the science when Leslyn talks. And so for me, that's been a huge gift too, is just sitting in rooms with you, even virtually, to learn and support and bring this conversation forward. And I think if I could start, one of the business person in me wants to say, let's tell people what the Lipedema Project does. I mean, you're the director of research, you're the board president, and I know people are used to Lipedema Simplified because we spend a lot of time live streaming there. But, there's such magical work happening that's so profoundly foundational to all of the lipedema patients, getting treatment and care and support. And we have some wonderful things to highlight today. But Leslyn, what is the difference between Lipedema Project and Lipedema Simplified? Just so the audience better understands where you play, and because we see you in both.
Yes. Yeah, sure. And I really have a defined position with Lipedema Project. This is a 501c3 charitable organization. So we are the main purpose of Lipedema Project is to increase awareness, actually worldwide, about lipedema, and to promote research and to promote that understanding of lipedema. I was just looking at some documents for Catherine over the weekend, and there is a huge need out there just for the general public, and especially the healthcare professionals, to be aware of lipedema. They don't even know about it. So that's our big pushes is increasing awareness and to foster research that will help us in our understanding of lipedema.
I think it's so important, and I'm so glad you're doing this. And Catherine, do you want to add anything about, as the founder of Lipedema Project, just what your vision was when you started and how you've maybe seen it grow? I mean, because this will help employers. This will help women who are working or caregiving or full-timing, whatever, on top of lipedema. The project is really making a huge impact in our lives. But I think sometimes it's almost the best kept secret because people see the membership side or the patient education side so much.
Lipedema Project was formed as a partnership with Lipedema Simplified and me, and with Dr. Mark Smith and at that point, Beth Israel Hospital in New York City. Beth Israel was soon acquired by what? Oh my goodness, I can't remember.
Was that Northwell Health or?
No, it was before Northwell
yes.
Health.
Yes.
The other one, it'll come to me. So a big system in New York. Anyway, they acquired. But I remember Beth Israel. Beth Israel was just the most wonderful hospital system in New York City. And so they really founded and sponsored us for the Lipedema Project for the specific purpose of raising awareness, because at that point, no one knew. We had they sponsored the very first Mount Sinai, that's it. I knew I'd come to me. Mount Sinai Beth Israel, it's now known as. But they sponsored the very first international conference on lipedema in April of 2015, which was shortly before I met you. I met you, Leslyn, in September, because in April we started Lipedema Project, and then Dr. Smith and I were both at that conference in Bethesda, because it was the first one ever in the lymphatics. So it's been a journey. And when I look at that, I was thinking about it this morning as I was listening to Dr. Roxon again, and welcome and introduce the NIH Commission, is that it's taken over 10 years, but that's not a long time when it comes to medicine. Yes. That there are amazing scientists and clinicians and researchers and advocates and even patients sitting together right now as we speak in Bethesda, Maryland, at NIH, discussing the future of lymphatic diseases and how we can integrate it into medicine. They were talking this morning about the brain and how, being able to have lymphatic drainage from the brain can affect things like Alzheimer's and dementia, and not only lymphatic diseases, but many, many other diseases. Anyway, you got me on my soapbox. I'm sorry. I'm going to stop now.
Oh, I love when you go on your soapbox, though, because the history is important. And I think one of the things that I think about just even in my 2.5 years with you all, how much has evolved in the last 2.5 years. So the fact that you have the history of 10 plus, that the Lipedema Project was founded early on in the process, the documentary came out. I think people that know my story know that documentary was what led me to find you, Catherine. I think it's a huge gift to the community to know the history, because so many times, especially with it becoming more popular on social media, people talking about it, I think it's just important to know that when you hang out with us, you're hanging out with the people that have been here for a long time doing this work, right? And I think that takes us right to, Leslyn, you have been working a lot with Dr. Roxon lately, even in this exciting news about the paper and the exciting news about the NIH asking for our input. So can we start there, Leslyn? What's a couple of things that the community should know about, especially the time-sensitive NIH opportunity?
Sure, we can start with that this commission that's meeting, as Catherine has been describing, they are actually looking for input from the community in general. So, and especially if you are someone who has a lymphatic disorder, usually it's lymphedema and lipedema, but there are others. And specifically talking to our community right here of people that are, listening to this podcast are usually people that have lipedema or know someone that has it. We need your input to this survey. And so we see a link here, and it's also down below for you to click on. And what you're going to do is you're going to go to that link, and it's going to ask you to give your input, your understanding, your what you want to the NIH to look at about different aspects of lipedema, diagnosis, care, and things like that. So please follow that link and let your voice be heard. We need lots of input.
Yeah, I'm really glad we have this, because we talk all the time how we're not heard by our doctor. I'm going to speak as a patient for a second. My doctor doesn't believe me. Nobody understands. They think I'm making it up, right? Well, if the NIH is asking for your input, if that doesn't make you feel a little bit better knowing, oh, this is real and they're actually doing something about it, I don't know what does, right? So that leads me to the proposed research case definition paper. And I think, Leslyn, just knowing how much time it's been, I'm so curious, we're at a precipice of a pretty big deal and a change. And I'm curious for you, what do you want to say about this paper? Or how does this paper help patients through the diagnosis process? And how does it help research?
Yeah. Well, and if you know me, you know I love to write. And so one of the things that we've done as part of the project is we've produced a lot of articles. And I would say that probably a majority of them have been about nutrition as it affects lipedema. But this latest one that just came out a couple months ago was a collaboration between experts around the world about lipedema. Our senior author is Dr. Stanley Roxon, and we have several other prominent experts that are on the paper as well. And this was a proposed framework for case definitions of lipedema for research. So our primary purpose was to strengthen research. If everybody is using the same definition, it's going to improve both specificity and sensitivity to identify people who have lipedema and people who don't have lipedema, so we can compare the two groups. But when you're identifying lipedema for research, can it also be used to identify the typical person going to her physician and wanting to know what's going on with her? And maybe she's heard of lipedema, maybe she hasn't. But more than likely, her doctor has not heard of lipedema. And so what we're discovering is this paper is so detailed on how to do an initial assessment and evaluation of someone. You can print out this paper and take it to your physician, and they can be guided to get a diagnosis. Now, maybe after going through it, you don't have lipedema, but we know that it's a lot more common than has previously been believed. So maybe you do. And the key is, because we've heard that there is tremendous delays in getting diagnosis, decades. And when you don't have a diagnosis, you can't get proper intervention. You can't get proper care. So our goal, one of our goals with the Lipedema Project, is we increase awareness so that people find out what's going on with them and they can get treatment in a more timely fashion. When I was looking at this document this weekend of Catherine, had a bunch of, it was pretty much the voices of the community, what they were saying. So a couple of them were saying, I'm concerned about my family. I'm concerned about my daughters. I want to know what's happening with me, and I want them to know what might be happening with them or could occur later in their life. And so if we can intervene in when someone is young. Our definition really looks at the adult female, even though we know that it might happen in males, it might happen in children, but there's just not a lot of research and a lot of papers written about those categories. And so if we can still use this, that maybe we can get even that young person identified and into treatment in a more timely fashion. And then all of those people out there that have been waiting for decades, it's not unusual to have someone say that, you know, I've been dealing with this my whole life, and now I'm in my 70s and I've never had treatment because I never knew what was going on. This is a problem, and we're hoping that our paper can be a way that really helps with that.
And I'll just add one thing, which is that we are just in the process, Leslyn and Dr. Roxon, myself, Siobhan Huggins, we're just in the midst of finishing up a very simple summary of the paper in one page, back and front, that actually gives an opportunity to do an assessment. Dr. Carmody, too. Dr. Carmody helped us with this.
I'm going to share something with you guys in this vein. So I held Lipedema Simplified, the patient-focused community, right? We are holding these circles in June, and we're inviting people with lipedema, or people that love people with lipedema, or people that treat people with lipedema and lymphedema, to in-person events, and just to get together and talk. And if you want to do one of those and you're not sure, the link is here. And we also are doing a virtual one coming up But what I want to share with you, Leslyn and Catherine, that happened for us and ours, there were younger women there who had figured it out, and they brought their moms. And their moms thought they were there because they were supporting their daughters. And the more we talked and the more we described things, the moms were like, do I have this too? Wait a minute. And they're we're like feeling my arms so they can see what the nodules feel like. And we're talking about hypermobility and all of the different things that come along with lipedema and lymphedema and, mast cell activation and pain. Like, we're talking about all this. And I saw moms, to your point, Leslyn, about having a late time to get a diagnosis, literally look at their daughters and think, I thought it was just you. Wait a minute. Right. And I was so excited because these women came to support each other. And in the process, when they started to think, well, maybe I have it too, they were being held. Because let me tell you, when I first figured it out, and it took me 53 years, I was by myself watching a documentary, crying my eyes out. But they were in a room with each other. And then we were talking about the paper and how you could look at, here's a way you can figure out your next step. So I know it's a research case definition, proposed research case definition. And I just think that to be able to use this for more than that is such a gift to the community. And it's going to help research explode, because I think what I heard when I was in Potsdam at the Lipedema World Congress in October was like in the last 5 years has been more research published than ever before. And now we can say, okay, control group for sure, they don't have lipedema. Here's the criteria that we're going to include, which is going to accelerate all of the research across the world. So I thought I would share that. Perhaps that one thing that maybe you didn't even think about this would do, and knowing that the moms are now learning from the daughters too.
Mm-hmm. Yeah, anything that promotes discussion and aha moments and learning for everybody who's involved. And just to talk a little bit about the research aspect of this, even though there's been an explosion in research, there's always been limitations to lipedema research. It's usually going to be small sample size. Maybe if they're testing intervention, it's over a short period. And the other thing is that they all use a different definition for what is lipedema. And so we can't then group a bunch of small studies and put them all together in a meta-analysis, because they've all used a different definition of lipedema. And so by using this framework and only accepting people into a lipedema group if they meet the criteria, and then making sure that the people who are in the control group don't have lipedema, then now we can take all these projects and put them together and analyze a bigger amount of data. I mean, it's so wonderful, but so expensive to do research studies. And so a lot of times they will have 10 or fewer participants in it, just because it's not affordable. It's hard to get those grants and that funding to do large scale projects. I just have the privilege of reviewing a paper that will soon be published, and their goal was to get 100 participants. They took 3 years and they only can get 10. So, I mean, so even if you have some funding, it's difficult to get enough to participate in groups. And so I just really feel like we're going to learn so much more if we all use our framework for putting people into these studies. And just to share with people that this framework is pretty strict. And even if you don't fit completely into the framework when you're trying to get a diagnosis, you may still have lipedema, because we have to be stricter for making sure that our research studies are clean and informative. And so, do not be discouraged. I think it says on our one-page information about using this framework for a diagnosis, that even if you don't fit that specifically, if some things some components are not there, it still means that you should probably pursue this further with an expert, because you might actually have lipedema. It's to get a diagnosis is not as strict as what we're saying.
I appreciate that. Really, So I'm going to say something, and Catherine, I'll bring your voice in. I'm not trying to take over. I know we're going back and forth here with Leslyn, but one of the things I think when I first got diagnosed, I thought I convinced my doctor because my doctor was open. I brought some paperwork. We talked about my symptoms. We didn't have this proposed case definition. And I left excited because she was like, okay, what do we do now? And thank goodness for Lipedema Simplified and the Lipedema Project. I knew what to do. But I still thought, did I convince her? Right? Wow. That was because I've been hearing so many doctors say, no, you don't have it. Right. And then I got to the point of, okay, so I have lipedema and lymphedema, right? Lipolymphedema, because I progressed before we figured this out. And I've always struggled with my weight my whole life. And then I just thought, is this just me giving myself like an excuse that, I'm not fat, I have a disease, right? And I'm not obese, I have a disease. And all these words would run through my head because of the way society is. And Catherine and I have talked about weight bias at work and our own bias against our own bodies, right? And I know, Leslyn, you recently presented with Dr. Carmody to I think it's an obesity. I don't want to botch it. If you could talk about that just for a minute for everyone to just basically lean in and better understand, you can't have obesity and lipedema, right? It's not one or the other. It could be. But when you present on lipedema to an association focused on obesity, how might that just inform our conversation briefly? Because there is so much that goes on walking in this world in our bodies and doing jobs and worrying about, our performance and are we perceived as lazy if we're dialing in from our car because we just came from MLD. So what do you want to say? What can you add to this conversation? Because your perspective, I think, is going to help women have agency and own their power in this and not wonder if they convince their doctors.
Yeah. And I think you bring up some excellent points because quite often lipedema doesn't travel alone. It often travels also with lymphedema, and quite often it travels with obesity. And both of those are also conditions, a disease that can be treated, but it matters how you treat them. And so Dr. Carmody and I were asked to speak for the Obesity Medicine Association, which is an organization of obesity medicine specialists. And they have an understanding of this is the disease of obesity and this is how you treat it. And one thing that Dr. Carmody and I share with them is that this is a different entity separate from obesity, but you already have these patients in your practice because they have been diagnosed with obesity and they're your patient already. But we treat obesity and lipedema differently. Different things are needed. Different interventions are needed. There is some overlap, some things that you will do that are going to help both. But some of the traditional ways to address obesity will not work with lipedema. And so we're hoping that this is going to expand their awareness so that now all those patients that they already have, that they realize have lipedema and not obesity, or maybe lipedema with obesity combined, they will know how to better intervene with them. And as a new person comes in, they will be able to diagnose and understand what's happening with that person, either as a singular diagnosis or in combination with other things. So this is the kind of outreach and awareness that the Lipedema Project wants to be engaged in. We need more people to understand this because it's just like when you were first diagnosed. Okay, I have this diagnosis. Now what do I do? What's the best treatment? Now, luckily, you were also involved with Lipedema Simplified, which is really engaged in patient advocacy and letting people know what they can do for treatment. We do all kinds of courses, both paid courses and free webinars. And we have the membership group. It's all about finding out what is the best way to intervene in your condition and to live your best life. So we were trying to do our own little thing with the obesity medicine presentation to get those healthcare providers on our side.
How did they respond?
Well, and this was a webinar where we didn't really have a chance for interaction with the members. It was for members only, and then we didn't have that interaction. I'm hoping that, I mean, Dr. Carmi and I both gave our email, and we're hoping we get some at least email interaction with them. And I hope to also, you know, be involved in their conferences and other webinars ongoing, because I think this is a continued discussion to help, you know, bring this community to understand lipedema even more.
Thank you. Catherine, what do you want to say?
Yeah, it's a very interesting thing. You mentioned it, Lisa, and I think it's worth repeating, which is that there is an inculcated bias towards fat. It's cultural. It is been here for as long as we can go back. You know, it's so some of our fertility goddess symbols that date back thousands of years. You see lipedema figures, the outline of lipedema. So we're talking about something that's been around for a very long time, yet the stigma and the anti-fat bias has prevented, I think we're getting through some of it, an awareness so that it can be treated as a disease. Imagine going in to see your doctor and you come up with a diagnosis of cancer, and the doctor comes in and says, well, you have cancer, but it's your fault. It's your fault because of lifestyle choices. You're doing something and you're making cancer happen. And in essence, if you think about it, that's essentially what's happening around lipedema. So a doctor comes in and says, well, you know, even if you do, but I think it's a made up internet disease, but, you know, you're fat and you have the ability to change that. And it's your lifestyle choices that are creating that. And so, I mean, literally, I've heard thousands of stories where women are like, I don't do that. That's not how it's not believed. And that's one of the obstacles that we need to surmount. It's truly at the foundation of what happens for so many in the healthcare system, which is why, you know, we advocate, you know, advocate for yourself. You need to understand that it is not your fault, that there is a physiology that's going on that is disease oriented. And it's a big deal, is all I can say.
It is a big deal. And this is why this conversation, this heart to heart right here matters, because when I think about my 82-week medically supervised weight loss program, 85 pounds down, just looking at my body, checking my medical, you know, blood work, everything every week, to come out and like my face to be like so thin, you could see like the indentations up here, but my arms and legs to still be large. And for them to say, well, you did the best you could. I'm like, that would have been the perfect time for them to, oh, you have lipedema. And I know like gastric bypass, when you're done with that, your legs don't change, your arms don't change. Oh, lipedema. So I think when you're on this journey and you're navigating your career or your full-time life, and you just keep thinking, I'm doing everything I can and it's not working, it's hard to stay positive. And this is why this conversation today is, I think, so filled with hope, because you've got the paper coming out, you're talking to the obesity docs, there's the case definition paper, the NIH asking for our input. And then also, I mean, Leslyn, this week you're doing a webinar on pain, because pain is part of this, right? And for me, I didn't even know I was in pain until we started talking about what pain was. I just thought my legs hurt. I don't like to stand. It's hard to walk, but I wouldn't say I was in pain, right? So I think we should talk about just what we can do and where there is hope, because there are things you can do about pain. So Leslyn, anything you want to say about your upcoming webinar?
Sure. I'm going to be presenting with Brian Hayward and with Jerry Hamill about what we can do for lipedema pain. But I think your point about that you don't even know you're in pain until maybe you're out of it, or someone helps you explore what the sensations are that you're experiencing. We did address that in our paper on the case definition, because you can't just ask someone who's been in chronic pain for the last several decades, do you have pain? We have absolutely amazing ways of coping with that and compartmentalizing it maybe, and ignoring it, or thinking that I don't have anything different from anybody else. I don't want to even mention this. And so it takes some discussion to really understand whether, for your own understanding on whether you're experiencing it, and then also to be able to communicate that with your healthcare provider. And just remember some discussions that I've had with other people, that even with their mobility question, which quite often gets affected by lipedema, they have had ways of coping with it. They have ways of getting around, of getting the job done. So I don't have any mobility problems because I've been able to deal with it. And so, so it's really having to understand and get that knowledge that this is a challenge for you. Yes, you've been doing fabulous, but it is a challenge and something that maybe we can make better. And so one of the things that we want to make better is pain. Pain associated with lipedema is pretty much a very central characteristic of lipedema. It really helps with getting that diagnosis. Some people have already had intervention, and maybe they no longer have the pain that they're experiencing before. But it is, for many people, it has been left unaddressed. Maybe they've tried medications, they've tried just not moving because then it doesn't hurt as much. So we want to talk in this webinar about all the various options. And in a short webinar, we can't really delve really deeply into all the options, but sometimes just knowing that there are options and that there are things you can talk to your healthcare provider about, or maybe even just some things you could try right away at home and see if that works for you. I was just thinking about, one of the things we talk about, Epsom salt baths. I think you guys both do that, right?
Yeah.
Yeah.
I had never done this before, but I was having some difficulty with plantar fasciitis, and people kept telling me, it's the pain on the bottom of your foot. People kept saying, well, try Epsom salts. And I'm going, okay, whatever. And then I was doing everything else except for that. And I just did 3 treatments. Oh my goodness. such a huge transformation. Why? I'm not really sure. Maybe just because salt is so important to life and comfort, but that it had a huge impact. And so it's things like that we're going to talk about. You could just do this already on your own. Give it a try. So we're going to be talking about all those kinds of things on Tuesday, this coming Tuesday, 4 p.m. Eastern. And remember, as with any of our free webinars, if you can't be there at that time, just still register, because you will get the replay. So you will still be able to get the information. So sign up.
I love it, love it, love it. Yes. Yay for Epsom salt. Yes. Yes.
It's
magnesium. You guys knew.
That's what, magnesium is magic. That's what I always say.
Yeah,
magnesium,
so salt and the magnesium, something about that combination.
Magnesium is magic. Yeah. I love that. Well, we're getting ready to wrap up, and I see lots of quotes, and we always like to bring some voices in from the audience who are here. We're so glad you're here. Anuya, Lisa, Sherry, Kristen. Kristen asked for the Lipedema Project website, so we can throw that up. She wants to add it to her website to promote it, which is great so people know. But Gail, if you see any quotes in there that you want to bring up, that would be great. Oh, Renita, yep, Epsom salt baths helped me in the past. Totally. Yeah.
I think that one person said that, is there a donate button for the Lipedema Project? Since this is a nonprofit and we really are able to accomplish more with your donations. So maybe you guys can talk about where they can find that link to make donations.
Yeah, Catherine, I think it's on the lipedemaproject.org,
it's on
right?
Go to lipedemaproject.org, and in the upper right-hand corner, there's a tiny, we should make it a little larger, but there's a tiny button that says donate.
Mm-hmm. Yes,
Yeah.
please help us continue our work and do our work even better.
It's interesting because I think people don't realize that even a $10 donation, what that does to be able to help with the infrastructure and drive some of these projects. So yeah, if you're moved at all by any of the work that the Lipedema Project has done or Lipedema Simplified, donating to the project helps us all. So yeah, thank you for asking that, Kristen. And then I saw another comment up here about someone who's just recently diagnosed and wants to be a speaker, because I can raise my hand to that. When I got diagnosed, I started to take my Pat. Yes, Pat. I feel you. I just launched my own speaker page because I took my day job and then my work over here, and my whole self now is talking about what it's like to be with lipedema. So I'm thrilled you're doing that, volunteering to spread the word. I'm on LinkedIn a lot, Pat. Maybe you can reach out there and we can talk about how to help you support in your own speaking journey as well. Tamara too, right? Yep. There we go. Yeah. So you can usually find me on LinkedIn. You can also email me, and I know we're going to drop that in the chat too. But just know that what I found to be the most powerful healing process was owning my story and being curious about how I got here. And I'm just so grateful. Catherine outed me. I said, okay, my speaker page is ready, but I haven't put it out in the world. And she's like, okay, everybody, here she goes. So you may need wing woman to move yourself into that phase, which worked for me. So yeah, thank you for that. I'm really glad you're here. So one of the things, Catherine, I always like to say is, Catherine has final thoughts, but so give yourself a moment to think, Catherine. Leslyn, how would you like to end our conversation today? Inspiration, thought process, idea, what lights you up? What should this audience know as we get ready to wrap up today?
I just would like to say that we're making tremendous strides in figuring out this condition and what works with helping manage those symptoms. There is hope. And one of the first things that you can do is to get that diagnosis and then move forward there. And we're hoping that we're helping with you to be able to get that diagnosis. And we really want to join with all of you to increase that awareness. And if you have ideas on how we can promote awareness within the world in general, but specifically with healthcare providers, email me. I'd love to hear from you. Leslyn at lipedemaproject.org. We all want to be part of the solution, and we want you to be part of the solution too.
Oh, thank you. I'm going to say one thing and then I'll turn over to you, Catherine. So Leslyn, you also host a very popular podcast series called Living Well with Lipedema. They're flash briefings on Alexa, but they're on every podcast platform. So I just want to let people know, if you like to geek out like Catherine and Leslyn do on all things research and science, you definitely want to check that out as well. And they're small snippets, right, that are just really easy to digest. And back to the beginning where they were saying Leslyn makes it easy to follow. Thank you for everything you do in the research area, Leslyn, and all of the prep you do for your live streams and your heart, your passion. I'm so grateful for you. And Catherine, I'll turn it over to you to wrap us up, because you always have such wonderful ways to send us off into the next week.
Well, there's one thing we haven't covered, and I feel like talking to Leslyn and not talking about this is sort of like just such a big gap, which is that Leslyn brought to the community the low carbohydrate food plan in keto and carnivore and various variations and adaptations to a low carbohydrate diet. When we were working, nothing had worked to help anyone reduce volume and weight. And when I met Leslyn, that was the research she was presenting at NIH. She was presenting the impact of a low carbohydrate food plan on lymphedema. And it was so cute. When I say cute, she had a little sticky on her research poster, and it said, "Would you like to do research? So would I." Or what did the little sticky say?
Would you like, I think it said, like, would you like to do research in this topic? Ask me how.
And so I'm like, oh, this is interesting. So we ended up, that was how Leslyn and I started working together. We started with a project to see if a ketogenic way of eating would affect lipedema, since there was her research, which was a small study, that said it did affect lymphedema. Anyway, to make a long story short, it was like a avalanche. So many women got involved. There were so many success stories. We did learn over the years that it needs adaptation, that people have to adapt to their own bodies and their own situations and their own comorbidities. So it's not as simple, here's a formula, it'll fit, but has amazing impact because of its impact on inflammation. And so I want to end. Usually I do a little more globally. Today I want to say that Leslyn has written 2 books on it. The Lymphatic Code is her more recent one. And what's the first one you wrote?
A ketogenic solution to lymphatic disorders.
And the latest one is the Lymphatic Code. So the 2 of them really make complex science accessible and understanding what goes on and how what you eat affects the lymphatic system. I highly recommend both of them. So on that note, let me end with saying there's hope. And that's the thing that I didn't know when I started. I was feeling so hopeless at one point, and thank goodness for Leslyn, because she really is a harbinger of hope.
Well, with that, yes, the books, I read them all on spring break. They are easy to read. And I was texting Catherine pictures. Look at this, look at this, look at this. So Leslyn, thank you for that too. I mean, you're just such a contributor to our overall well-being and our hope. It's a joy to work with you. Thank you for being our guest today in this Heart to Heart. Everyone, thank you for participating. Tamara, I see we're so blessed to be with all of you. So there's lots of love for you all in here. I would highly recommend reading the chats. And for those of you on the replay or listening to the podcast, Leslyn's email is out there. Please feel free to reach out. I mean, she means it when she says it. It's one of those situations that's real and true. Catherine, thank you for being the beacon of hope to so many on this journey when you started it all. And I'm just really grateful for you both and for the audience today. So until next time, thank you for being with us at Heart to Heart, because we are navigating lipedema together. That's how you do it, right? Take care, everyone. Thank you.
Thank you.